Hi, I'm Dr. Elizabeth Livengood. I'm the medical consultant to Yahweh Yoga and also one of their teachers in the 200 and 500-hour teacher training programs. I'm also a licensed naturopathic doctor working in Phoenix, Arizona. You're here because you're wondering, what do you do if you've had a cardiac event and you're sent home from the hospital? What do you do next? Well, you'll probably be referred back to your primary care physician. And while it may be tempting to skip an appointment with a general practitioner, this is actually a really important visit. Your primary care doctor is the connecting point amongst all the specialists and the hospitalists. So this person manages your overall well-being and will have the big picture of your health and all of your lab records, whereas the specialists sometimes only look at the parts that are pertinent to their area of expertise. You should expect to have some lifestyle changes coming your way. Your general practitioner is just the right person to coach you through these. These lifestyle changes will help you optimize your weight, reduce your risk factors for future cardiac events, and also reduce or eliminate compounding factors such as diabetes and smoking. Some questions you can ask your GP at the visit are, what types of exercise are healthy for me right now? Number 2, ask what type of diet should I be on? Also, ask about what type of supplements might be helpful to reduce your cardiac risk and also mitigate some of those other compounding factors that your general practitioner will know about when they've reviewed all your medical records. With those supplements, you might ask if there are any side effects or interactions with your medication. You'll also want to ask if there are any other risk factors in your overall health picture and what those are, what you can be doing to mitigate those risk factors. Ask for a physical. If your GP doesn't do a complete physical, then ask for a referral to someone who does. A complete physical will include lab work and also a hip to waist ratio. These are important things to know concerning cardiac risk. So speaking of labs, besides the baseline complete blood count and metabolic panel, there are some other specialized labs that can help define your cardiac risk even better. So it would be great to find out what those specialized lab tests are and if your doctor does them. If your regular GP doesn't do specialized in-depth testing, then look for a naturopath or an integrative doctor who does. Here are some examples of lab markers that directly affect your cardiac health. GGT is a liver enzyme. It's often associated with alcohol intake, but it's actually a risk factor for increased risk of stroke and cardiovascular disease. So by taking care of our liver, we can also reduce the risk for these events. Omega-3s, your essential fatty acids, are also risk factors, if they're low, for myocardial infarction or heart attack. So just knowing what your level of omega-3s are can help you know if you need to supplement them or not. Fibrinogen is a general inflammation marker, but it's also been found to be an independent risk factor for coronary artery disease. So by reducing inflammation, you're reducing your risk of coronary artery disease. Uric acid is associated with gout, but it's also a marker for coronary artery disease, along with hypertension and metabolic syndrome. So we know that through specific dietary changes, you can reduce uric acid in your blood if that comes up on one of these specialized tests. And then finally, lipid subtypes can further be evaluated for very specialized molecules that can be modulated through your diet and exercise, but you've got to know what they are. So ask about these specialized lab tests through your GP, your naturopath, or an integrative doctor. Of course, follow up with your specialists as recommended. You may contact me at Dr. Livengood at yahwehyoga.com or visit my website, drelizabethlivengood.com. I can see patients in person in Phoenix, Arizona, or via telemedicine anywhere in the world.